Hmm. Hey everyone, Assalamu alaikum wa rahmatullahi wa barakatuh. This is Hana again, and last night we had no internet connection. We were interrupted by Globe at home, so unfortunately, uh, our practice exam has been um our practice exam has been, what do you call this? Uh, Interrupted. So if I yesterday we already solved from 31 to 60. So today we will go ahead and answer 61. We're supposed to answer 61 to 100, 61 to 90 today. If we can, we'll make it to 100. Before we do the review, we first and foremost have to pray and ask Allah subhanahu wa ta'ala to guide us and to grant us the intellect to comprehend and understand what we are studying and to make this lesson beneficial for us. We pray, Allahumma anfa'ni bima 'allamtani wa 'allimni ma yanfa'uni wa zidni 'ilma. رب زدني علما اللهم يا معلم إبراهيم علمني ويا مفهم سليمان فهمني يا رب العالمين. Now, question number 61. Nurse Amy is aware that the following is true about functional nursing: concentrates on tasks and activities, one-to-one nurse-patient ratio, provides continuous coordinated and comprehensive nursing services, emphasize the use of group collaboration. This is the answer. Functional nursing is focused on tasks and activities and not on the care of patients. Okay. Nurse Oliver measures a client temperature at 102 degrees Fahrenheit. What is the equivalent centigrade temperature? Now, in determining the conversion from Fahrenheit to centigrade Celsius, we have to use a formula. So 102. So the formula from Fahrenheit to Celsius is we 102 minus 32 times 5 over 9. That's how we do it. 102 minus 32 times 5 over 9. That is equivalent to, okay, let's try to use a calculator. Okay, I'm using calculator separately on my phone. 102 minus 32 times 5 over 9. Now we get the answer of 38.88889, and which gives us 38.9. This is the answer. So here it is to convert Fahrenheit. So how about if we convert Celsius to Fahrenheit? So Celsius to Fahrenheit. This topic has been taught since elementary, since grade school, but this is why it's very important to constantly review your lessons going back, especially the conversion to the units, because you will always be using that. Now, in order to convert Celsius to Fahrenheit, first of all, the Celsius times 9 over 5 plus 32. So again, in order to convert Fahrenheit to Celsius, Fahrenheit minus 32 times 5 over 9. Whereas for Celsius to Fahrenheit, we use Celsius times 9 over 5 plus 32. So that's how we do it. Next one. Which type of evaluation occurs continuously throughout the teaching and learning process? Evaluation occurs continuously throughout the teaching learning process: formative, informative, summative, and retrospective. Okay, it's formative. Let's learn about it. Formative or concurrent evaluation occurs continuously throughout the teaching and learning process. Okay. One benefit is that the nurse can adjust teaching strategies as necessary to enhance learning. Summative or retrospective evaluation occurs at the conclusion of the teaching and learning lesson. Informative is not a type of evaluation. That's really funny. The reason why I entered informative is because it's the only thing I know about here. So I actually don't know these things, but I'm happy to learn about it right now. So formative evaluation occurs continuously throughout teaching and learning process. So that's a formative evaluation. Next one, John plans to use a Likert scale to his study to determine the compliance to expected standards, level of satisfaction, degree of acceptance, degree of agreement, and disagreement. I'm very familiar with Likert scale because this is what we used in our research study, so it's about agreement and disagreement. Likert scale is a 5-point summated scale used to determine the degree of agreement or disagreement of the respondents to a statement in a study. Now, next one. We're at question 65. Okay. Nurse Rees is teaching a female client with peripheral vascular disease about foot care. Nurse Rees should include which instruction? Okay, peripheral vascular disease about foot care. Okay, avoid wearing cotton socks, using a nail clipper to cut toenails, avoid using cornstarch on feet, avoid wearing canvas shoes. Hmm. I don't get why would you use cornstarch on your feet? I don't know what a canvas shoes is, but I feel like this is the answer since we're talking about peripheral vascular disease and it's got something to do with the circulation. So the client should be instructed to avoid wearing canvas shoes. Canvas shoes cause the feet to perspire, which may in turn cause skin irritation and breakdown. Both cotton and cornstarch absorb perspiration. The client should be instructed to cut toenails straight across with nail clippers. So first of all, we have to find out what what does it mean when we say canvas shoes? I have to Google it right now. Canvas shoes. Oh, so a canvas shoe is actually the kind of shoe, a light shoe with canvas upper, rubber, leather, and fiber shoe. It's like a tennis shoe, like the one you have with the shoelaces. Okay. Question 66. The physician orders dextrose 5% in water, 1000 ml to be infused over 8 hours. The IV tubing delivers 15 drops per ml. Nurse John should run the IV infusion at a rate of, oh my goodness, I clearly remember the formula of this one, but I forgot it. So, in order to identify the infusion rate, we have to, I remember that the denominator for 8 hours is that 8 times 60. So that's what we are going to divide these into. So let's try, okay, I kind of got it now. 1000 ml times 15 drops. Okay, let's just try it. Divided by 8 hours times 60 minutes. Now, I got an answer of 31.25, but it's not among the choices. We only have here 30 and 32. Now, let's try to include 5%. I'm not sure. 5 times 1000 times 15 drops divided by 8 times 60. Okay, so that's not the issue anymore. Again, we're only looking for drops per minute. So this ml from 1000 and this ml from 15 drops per minute will actually have to cancel each other out, leaving only drops. And for hours, we're going to convert it into minutes. So um, an hour gives us 60 minutes, right? So we have 480. Okay, let's try it. 1000 times 15, because we have to cancel out the ml from both, divided by 8 times 60 minutes. Now we have the answer of 31.25, and the closest answer to this is 32. Okay, that's correct. Now, Giving 1000 ml over 8 hours is the same as giving 125 ml over 1 hour, 60 minutes. Find the number of millimeters per minute as follows. Okay, I'm so happy. I still remember the formula for this. The formula for this, you basically multiply the volume of the solution to be infused and the drops per ml and cancel out both ml. That leaves you with only the drops. And for 8 hours, you multiply it, convert it into minutes. Now, next one. She finds out that some managers have benevolent, authoritative style of management. Which of the following behaviors will she exhibit most likely? Assalamu alaikum wa rahmatullahi wa barakatuh, my beloved people. Today is the 13th day of the Hijjah, so don't forget to constantly say your takbirat until Asr of today. That is a huge opportunity. It was just my day, my Instagram story. I'm sorry. Okay, back to work. She finds out that some managers have benevolent, authoritative style of management. Which of the following behaviors will she exhibit most likely? Okay, benevolent, authoritative style. So it means something good and authoritative. Okay, allows decision making among subordinates, gives economic and ego awards, communicates downward to staffs, having condescending trust and confidence in their subordinates. Um, I'm not sure about making decision. I don't think so. This is authoritative, so she makes all the decision herself. Economic. It could be that she gives economic and ego awards, or it could be having condescending trust and confidence in their subordinates. It's among these two that I am doubting about. So benevolent, authoritative. By when we say benevolent, we refer to something good, right? Benevolent. Let's try to Google the meaning in case we find some clues here. Benevolent is charitable rather than profit making, well meaning. So let's try this economic and ego awards. Oh no, it's about having condescending trust and confidence. Oh, that's what I've been trying to, that's what my mind has been telling me, but I did not listen. Benevolent, authoritative managers pretentiously show their trust and confidence to their followers. Okay, next question. Nurse Jana is collecting a sputum specimen for culture and sensitivity testing from a client who has productive cough. Nurse Jana plans to implement which intervention to obtain specimen? Okay. Ask the client to expectorate a small amount of sputum into a Mrs. basin. Use a sterile plastic container for obtaining the specimen. Provide tissues for expectoration and obtaining the specimen. Ask client to obtain specimen after breakfast. No, don't ask the client after breakfast. Obtain the specimen the first thing in the morning when she wakes up, okay? Okay, no, you're not going to ask the client to put the sputum into the basin. That is gross. This one, I think, is the answer. Use a sterile plastic container for obtaining the specimen, but we'll see. Okay, it is correct, alhamdulillah. So sputum specimens for culture and sensitivity testing need to be obtained using sterile technique because the test is done to determine the presence of organisms. If the procedure for obtaining the specimen is not sterile, then the specimen is not sterile. And then the specimen would be contaminated and the results of test would be invalid. That is true because there are other microorganisms in other surfaces of other containers. So it's very important to have the container sterile. Question 69. A female client is to be discharged from an acute care facility after treatment for right leg thrombophlebitis. The nurse Betty notes that the client's leg is pain-free. Without redness or edema, the nursing action refers to which step of the nursing process. But it's easy to answer this one because it talks about the nursing process, but I want to know about thrombophlebitis. I've already heard this before, perhaps even studied this before, but I need to review it. Thrombophlebitis is swelling inflammation of a vein. A blood clot, thrombus in the vein can cause this swelling. Okay, so it's about blood clot that causes swelling. Okay, female client is about to be discharged. Okay, the nurse Betty notes that the client's leg is pain-free without redness or edema. Okay, this nurse, it is assessment. Evaluation. Okay, I'm sorry. It's about rights discharging. The nursing actions described constitute evaluation of the expected outcomes. The findings show that the expected outcomes have been achieved. Assessment consists of the client's history, physical examination, and laboratory studies. Analysis consists of considering assessment information to derive the appropriate nursing diagnosis. The implementation is the phase of the nursing process where the nurse puts the plan of care into action. Next one. Monica is aware that there are times when only manipulation of study variables is possible and the elements of control or randomization are not attendant. Which type of research is referred to this? Okay, Solomon for group design, post-test only study design, field study, quasi-experiments. Manipulation of study variables is possible. I'm not sure, but yeah, it's quasi-experiment is done when randomization and control of the variables are not possible. The reason why I know about this is because this was the one we used in our research study, so I've heard about it. Next question. A male client complains of abdominal discomfort and nausea while receiving tube feedings. Which intervention is most appropriate for this problem? Okay. Give the feedings at room temperature, place the client in semi-followers, charge feeding container, decrease the rate of feedings at concentration of the formula. Decrease the rate of feedings and concentration of the formula. Complaints of abdominal discomfort and nausea are common in clients receiving tube feedings. Decreasing the rate of the feeding and concentration of the formula should decrease the client's discomfort. Feedings are normally given at room temperature to minimize abnormal abdominal cramping. To prevent aspiration during feeding, the head of the client's bed should be elevated at least 30 degrees. Also, to prevent bacterial growth, feeding containers should be routinely changed every 8 to 12 hours. I'm starting to get a little sleepy now. Don't sleep, Hana. Come on, wake up. Okay. Nurse Marion is preparing to administer a blood transfusion. Which action should the nurse take first? Start an IV? No. Compare client's identification? Yep, but I don't think that's the first. Measure the client's vital signs? Yep. And destroy the award. Oh gosh, I'm falling asleep. Oh, arrange the typing and cross-matching of the client's blood. Did I read this one? Okay, the nurse first arranges for typing and cross-matching of the client's blood to ensure compatibility with donor blood. The other options, although appropriate when preparing to administer a blood transfusion, come later. I feel so sleepy. How am I gonna wake up? A female client with fecal impaction frequently exhibits with clinical manifestation. Okay, I'm falling asleep. Okay. Female client is with a fecal impaction frequently exhibits which clinical manifestation? Fecal impaction. I'm not sure. It's a liquid or semi-liquid stools. Passage of liquid or semi-liquid stools results from seepage of unformed bowel contents around the impacted stools in the rectum. Plants with fecal impaction does not pass hard, brown formed stools because the feces can't move past the impaction. These glands typically report the urge to defecate, although they can pass stool and a decreased appetite. Nurse John develops methods for data gathering. Which of the following criteria of good instrument refers to the ability of the instrument to yield the same results upon its repeated administration? Okay. Oh, I'm not sure. Hey everyone, Assalamu alaikum wa rahmatullahi wa barakatuh. This is Hana again, and I am back from a very, very long hours of sleep and eating and resting and wasting time on social media. So, I'm happy to get back on track and to try to answer our questions again here. So we're now at question 74, and why did I get this wrong? Okay, earlier I think I was just so tired, so sleepy because we've had a very long walk in the morning, and I just rested afterwards. So after answering this, I think I fell off asleep because even while answering this, like, I could not keep my eye open. But accordingly, let's review this because I don't think I can remember this exactly. Nurse John develops methods for data gathering. Which of the following criteria of a good instrument refers to the ability of the instrument to yield the same results upon its repeated administration? So reliability is the answer. It is a consistency of the research instrument. It refers to the repeatability of the instrument in extracting the same responses upon its repeated administration. Now let's try to do another one. Now let's try to do another one. Continuation of this. Question number 75. An 80-year-old male client is admitted to the hospital with a diagnosis of pneumonia. Nurse Oliver learns that the client lives alone and has not been eating or drinking. So when assessing him for dehydration, Nurse Oliver would expect to find, okay, take note that we're talking about an 80-year-old male client, geriatric patient, and he has a diagnosis of pneumonia, and the client lives alone and has not been eating or drinking. So when we are assessing for dehydration, we expect to find distended neck veins, tachycardia, hypothermia, hypertension. So tachycardia is actually the correct answer. With an extracellular fluid or plasma, volume deficit compensatory mechanisms stimulate the heart, causing an increase in heart rate. That is a symptom of dehydration. Never forget. Okay? Now, the leader of the study knows that the certain patients who are in specialized research setting tend to respond psychologically to the conditions of the study. This is referred to as cause and effect, halo effect, Horns effect, Hawthorne effect. Oh my goodness. I sure have encountered this in our PowerPoint presentations in our school, and this has been discussed to us by our instructor, but I don't listen to my instructor at all because, well, hear me out. Her name is Miranda. I mean, that's her surname. But my teacher, even for no reason, she nags at us for no reason. Like, she does it for fun. Like, it's already her personality, her habit. Whenever she teaches, she likes to nag. And because of that, I don't listen to her classes at all. Actually, I don't even enter her classes. I skip her classes. So, certain patients who are in specialized research setting tend to respond psychologically into the conditions of the study. So, absolutely, uh, psychologically responding. Is it Hawthorne or Halo? Oh, I got it correct. It's actually Hawthorne effect. Yeah, I kind of remember it because, I read this once in our PowerPoint presentation. Okay, so Hawthorne effect is based on the study of Elton Mayo and company about the effect of an intervention done to improve the working conditions of the workers on their productivity. It resulted in increased productivity, but not due to intervention, but due to psychological effects of being observed. They performed differently because they were under observation. Now, let's try another one. Miss Garcia is responsible to the number of personnel reporting to her. This principle refers to, okay, I have not encountered this. So Miss Garcia is responsible to the number of personnel reporting to her. Unity of command, downward communication, leader, span of control. Is it downward communication? Is it span of control? Okay, so Miss Garcia is like on top, and then there are these number of personnel reporting to her. So I don't know. I'll just answer whatever. It's a span of control. Span of control refers to the number of workers who report directly to a manager. Okay. Next one. Which of the following vital sign assessment that may indicate cardiogenic shock? Okay. Which of the following vital sign assessments may indicate cardiogenic shock after myocardial infarction? Okay. BP 180 over 100, pulse 90 irregular, BP 80 over 60, pulse 110 irregular. I got it correct. It's 80 over 60, pulse 110 irregular. The classic signs of cardiogenic shock are low blood pressure, rapid and weak irregular pulse, cold clammy skin, decreased urinary output, and cerebral hypoxia. Now, patient's refusal to divulge information is a limitation because it is beyond the control of Tiffany. Okay? Patient's refusal to divulge information is a limitation. Okay, the answer is descriptive correlational. I got it correct. Descriptive correlational study is the most appropriate for this study because it studies the variables that could be the antecedents of increased incidence of nosocomial infection. There's no such thing as nosocomial infection mentioned in the question. That's so unfair. Next, question 80. So we'll try to finish this until 100. We can do it. Well, let's try to do it fast. Nurse Gail places a client in 4-point restraint following orders from the physician. The client care plan should include socialize with other patients once a shift, check circulation every 15 to 30 minutes, assess temperature, and provide operational activities. So I got it correct. My answer is check circulation every 15 to 30 minutes. The restraints encircle the limbs, which place the client at risk for circulation being restricted to the distal areas of the extremities. Checking the client's circulation every 15 to 30 minutes will allow the nurse not to adjust the restraints before injury from the decreased blood flow occurs. Okay. Next question, 81. The maximum transfusion time for a unit of packed red blood cell is, let's try 2 hours. Oh, 4 hours. Oh my goodness. Yeah, right. I remember. It's so fresh in our memory. I mean, this is like one of the last topics we've discussed in nursing school before the semester end. So, a unit of packed RBC may be given a period of between 1 and 4 hours. It should not infuse for longer than 4 hours because the risk of contamination and sepsis increases after that time. Discard or return to the blood bank any blood not given within this time according to facility policy. Another one, Nurse Len refers to a female client with terminal cancer to a local hospice. What is the goal of this referral? To provide support for the client and family coping with terminal illness, to help client find appropriate terminal treatment options, to ensure the client gets counseling regarding healthcare cost, to teach the client and family about cancer and its treatment. So take note, we're talking about terminal cancer. So we need support for the client and family in coping with the terminal illness. So it is correct. Hospices provide supportive care for terminally ill clients and their families. Hospice care does not focus on counseling regarding healthcare costs. Most clients referred to hospices have been treated for their disease without success and will receive only palliative care in the hospice. Now let's try another one. A male client with a right pleural effusion noted on chest x-ray is being prepared for thoracentesis. The client experiences severe dizziness when sitting upright. Okay, when severe dizziness when sitting upright, this is actually orthopedic hypotension. So it's something normal for people who either have hypertension or either because they've been lying down for too long. Now, to provide a safe environment, the nurse assists the client to which position for the procedure. Prone with head turned towards the side, supported by pillow. Sims position with the head of the bed flat. Okay, this is why I must review what positions are. I know what a prone is, but Sims position, I have to review it. I mean, I got it a picture in my mind, but I'm not quite sure because of the loads of information we have here. So the Sims position. Okay. The person is lying on the left side. Okay. So this is how it is. Okay. Right side lying with the head elevated 45 degrees. Left side lying with the head of the bed elevated 45 degrees. So we're talking about getting a chest X-ray. So the client cannot sit upright. So of course we have to elevate 45 degrees. So let's try. Okay, the right side lying with head but elevated and left side. These two are quite similar. The only difference is the direction. So we're not going to select these two, C and D. We're not going to select them. We're going to select this one, prone with head turned toward the side, supported by a pillow, or Sims position with the head of the bed flat. So, in taking a chest x-ray, you actually have to face the x-ray. So the chest is based on the x-ray. So a Sims position, uh, Sims position, no, it doesn't actually let you do that. So prone is over there, like that. Um, let's try Sims. Okay, the answer is left side lying with the head of the bed elevated 45 degrees. Now let's try to understand what it means. To facilitate removal of fluid from the chest wall, the client is positioned sitting at the edge of the bed, leaning over the bedside table, with the feet supported on a stool. If the client is unable to sit up, the client is positioned lying in bed on the unaffected side with the head of the bed elevated 30 to 45 degrees. On the unaffected side. Oh, I see. We missed something very important in the question. So, in this question, it has been described that a male client with a right pleural effusion, there has been a direction indicated that the client has a right pleural effusion. So, we have to place the client on the opposite side, which is the left side. I missed that very important point, so this is why it's very important to analyze the question carefully. Now, in assisting a female client for immediate surgery, the nurse in charge is aware that she should encourage the client to drink water prior to surgery, encourage the client to avoid following preoperative medication, assist the client in removing dentures and nail polish, explore the client's fears and anxiety. So we're talking about female client for immediate surgery. We have to assist the client in removing dentures and nail polish. That's correct. Dentures, hairpins, gums must be removed. Nail polish must be removed so that cyanosis can be easily monitored by observing the nail beds. Right. That is so good. Now, let's try another one. Nurse Patricia is reconstituting a powdered medication in a vial. After adding the solution to the powder, the nurse should invert the vial and let it stand for 3 to 5 minutes. Do nothing. Roll the vial gently between the palms. Shake the vial vigorously. Okay, roll the vial gently between the palms is the correct answer. Rolling the vial gently between the palms produces heat, which helps dissolve the medication. Doing nothing or inventing the vial wouldn't help dissolve the medication. Shaking the vial vigorously could cause the medication to break down, altering its action. Okay? Nurse Oliver is assessing a client's abdomen. Which finding should the nurse report as abnormal? Vascular sounds heard over the renal arteries, dullness over the liver. Okay. Abnormal. Okay, shifting dullness over the abdomen is the correct answer. Shifting dullness over the abdomen indicates ascites. An abnormal finding. The other option are abnormal abdominal findings. So shifting dullness over the abdomen is ascites. You know ascites, like the big tummy one? When your belly becomes big, inflamed? Okay. There's edema of the tummy, abdomen. Okay, a newly admitted female client was diagnosed with agranulocytosis. The nurse formulates which priority nursing diagnosis. So, agranulocytosis, we have to read about this briefly first. Uh, Granulocytosis is a serious condition that occurs when there is an extremely low number of granulocytes in blood. Okay. Risk for infection, because we're talking about low amount of granulocytes in blood, and granulocytes are red blood cells. I mean, white blood cells, yeah. So agranulocytosis is characterized by reduced number of leukocytes, leukopenia, and neutrophils, neutropenia, in the blood. The client is at high risk for infection because of the decreased body defenses against microorganisms. The deficient knowledge related to the nature of the disorder may be appropriate diagnosis, but it is not the priority. A male client is admitted and diagnosed with acute pancreatitis after a holiday celebration of excessive food and alcohol. Which statement finding reflects this diagnosis? Hyperactive bowel sounds, sudden onset of continuous epigastric and back pain, blood pressure above normal, pains and crackles above. Okay, we're talking about acute pancreatitis. So it is the sudden onset of continuous epigastric and back pain. The autodigestion of tissue in the pancreatic enzymes results in pain from inflammation, edema, and possible hemorrhage. Continuous unrelieved epigastric back pain reflects the inflammatory process in the pancreas. Now let's try another question. Which nursing intervention takes highest priority when caring for a newly admitted client who's receiving a blood transfusion? Okay, now it's about prioritizing. Number one, letter A, informing the client that the transfusion usually takes 1/2 to 2 hours, assessing the client's vital signs when the transfusion ends, instructing the client to report any itching, swelling, dyspnea, documenting blood transfusion in client care record. Correct. Now, it is about instructing the client to report any itching, swelling, and dyspnea because there could be transfusion reaction. Okay, let's read the explanation. Because administration of blood or blood products may cause serious adverse effects such as allergic reactions, the nurse must monitor the client for these effects. Signs and symptoms of life-threatening allergic reactions include itching, swelling, and dyspnea. Although the nurse should inform the client of the duration of the transfusion and should document its administration, these actions are less critical to the client's immediate health, and the nurse should assess vital signs at least hourly during the transfusion. Tony, a basketball player, twists his right ankle while playing on the court and seeks care for ankle pain and swelling. Okay, after the nurse applies ice to the ankle for 30 minutes, which statement by Tony suggests that ice application has been effective? My ankle appears redder now. My ankle feels warm. My ankle looks less swollen now. I need stronger. Okay, correct. My ankle looks less swollen now. Ice application decreases pain and swelling. Continued or increased pain, redness, and increased warmth are signs of inflammation that should not occur after ice application. Now let's finish this until 100. We're now at question 91. Nurse Myrna is aware that the Board of Nursing has quasi-judicial power. An example of this power is the board prepare the board examinations. The board can issue rules and regulations that will govern the practice of nursing. The board can visit school applying for permits in collaboration with CHED. The board can investigate violations of the nursing law and code of ethics. Okay. Okay, the board investigate violations of nursing law. Quasi-judicial power means the Board of Nursing has the authority to investigate violations of the nursing law and can issue summons, subpoena, or subpoena duces tecum as needed. Now, Mary decides to use judgment sampling on her research. Which of the following actions is correct? Assigns number for each patient, places these in a fishbowl and draw 10 from it. Decides to get 20 samples from the admitted patients, determines the different nationality of patients frequently admitted, and decides to get representation samples from each, plans to include whoever is there during his study. That's correct. So, judgment sampling involves using samples according to knowledge of the investigator about the participants of the study. So, for this question, I answered data means the different nationality of patient frequently admitted and decides to get representation samples from each. Let's try to answer this in 5 minutes or 10 minutes. And we've got 7 questions left. Let's try to answer in 7 minutes. A child of 10 years old is to receive 400 cc of IV fluid an 8-hour shift. The IV drip factor is 60. The IV rate that will deliver this amount is, okay, 400 cc. Okay, let's try to use a calculator. So I'm going to use my desktop for it. The reason for that is I actually have a calculator. I wonder where it is now, to be honest. I can't seem to find it, but anyways. So 400, and we multiply it by 60, and we divide it by, okay, so it's 24,000. So 24,000 divided by 8. No. Okay, let's try another way. 400 divided by 60 times 8. Okay, let's try to answer 55. Oh, it's 50 only. The rate, okay, of 50 cchr, the child is to receive 400 cc over a period of 8 hours, 50 cc per hour. Okay. Which dietary guidelines are important for Nurse Oliver to implement in caring for the client with burns? Monitor intake to prevent weight gain. Provide high protein, high carbohydrate diet. Okay. High fiber, high fat diet, ice chips or water intake. Right, correct. It's about providing high protein, high carbohydrate diet. A positive nitrogen balance is important for meeting metabolic needs, tissue repair, and resistance to infection. Calorie goals may be as high as 5,000 calories per day. And another one. Nurse Len is administering sublingual nitroglycerine, nitrostat, to the newly admitted client. Immediately afterward, the client may experience, okay, drowsiness or blurred vision, tinnitus or diplopia, nervousness or paresthesia, throbbing headaches, or dizziness. So, um, okay, I got it correct. It's about throbbing headaches and dizziness. Headaches and dizziness often occur when nitroglycerin is taken at the beginning of therapy. However, the client usually develops tolerance later on. Next, Nurse May is aware that the main advantage of using a floor stock system is the nurse can implement medication orders quickly. The nurse receives input from the pharmacist. The system minimizes transcription errors. Okay. Okay, I got it correct again. The nurse can implement medication orders quickly. A floor stock system enables the nurse to implement medication orders quickly. It does not allow for pharmacist input, nor does it minimize transcription errors or reinforce accurate calculations. Which of the following theory addresses the 4 modes of adaptation? Callista Roy, Florence Nightingale, Jean Watson, Madeline Leininger. So we're only talking between Callista Roy and Jean Watson. So I don't want to get this wrong. 4 modes of adaptation. Adaptation. Oh, it's actually Callista Roy developed the adaptation model, which involves the physiologic mode, self-concept, role function, and dependence mode. Okay. Gene Watson is the theory of Gene Watson theory. Oh, Gene Watson's theory is about interpersonal caring. Right. Okay. Human caring. Next one. The physician inserts a chest tube into a female client to treat pneumothorax. Okay. The tube is connected to water seal drainage. The nurse in charge can prevent chest tube air leaks by keeping the head of the bed slightly elevated, keeping the chest drainage system below the level of the chest, checking and tapping all connections, checking patency of the test tube. Okay, checking and tapping all connections is the correct answer. Air leaks commonly occur if the system is not secure. Checking all connections and tapping them will prevent air leaks. The chest drainage system is kept lower to promote drainage, not to prevent leaks. Now, this is the second to the last question. Come on, we can do it. A 65-year-old male client requires his medication at 9 p.m. instead of 10 p.m. so that he can go to sleep earlier. Which type of nursing intervention is required? Okay. Independent? That's right, independent. So nursing interventions are classified as independent, interdependent, or dependent. Altering the drug schedule to coincide with the client's daily routine represents an independent intervention, whereas consulting with a physician and pharmacist to change the client's medication because of adverse reactions represents an interdependent intervention. Administering an already prescribed drug on time is a dependent intervention. An interdependent nursing intervention does not exist. Okay. And for the last question of the day, Nurse Hazel is preparing to ambulate a female client. The best and safest position for the nurse in assisting the client is to stand, okay, in front of the client on the affected side, on the unaffected side, behind the client, on the affected side. Right, correct. When walking with clients, the nurse should stand on the affected side and grasp the security belt in the midspine area of the small of the back. The nurse should position the free hand at the shoulder area so that the client can be pulled toward the nurse in the event that there is a forward fall. The client is instructed to look up and outward rather than at his or her feet. And that's how we got um the uh the answers. Okay. So accordingly I scored um 24 out of 100. That's terrible. Actually, that's because we only started at 61. So today we were able to answer uh 40 questions, and I scored 24 out of those 40. Um yeah, that's about 50% of it, but we can do better next time. So, thank you so much, guys, for reviewing with me. And I think my score yesterday was also pretty similar to this one. But, yesterday was 30 items, so it was like, it was pretty much similar to this one as well. Thank you so much, guys, for reviewing with me, and I look forward to seeing you again tomorrow for another beautiful review session. Bye bye.